Did you know that 82% of the people who passed away in the UK last year were diagnosed with a medical condition that is preventable or manageable with good nutrition? These are just some examples that many of us are familiar with. Their rates are skyrocketing worldwide, and food plays a massive role in their management and outcome. Unfortunately, most of the cultures of the world have been left out of research and practice and aren't represented in nutritional guidelines. As a result, nutritionists and dietitians who are the best equipped to help people restructure their diets are lacking critical information that they need to help their patients succeed. Meet Anna. She is doing her absolute best, but has hundreds of patients a year and only a few hours to spend with each of them. She needs a tool that will help her relate, communicate, and educate much more effectively. The solution is where EVYN comes in. EVYN is a modular visual nutrition planning platform that's available on the web or as an app. Say Anna gets this patient. Amina is struggling with irritable bowel syndrome, anxiety, and skin issues. To help her build a sustainable eating pattern, Anna needs to incorporate as many aspects of her life as possible, one of the most important being culture. Culture helps determine when and what we eat and how and why we eat it. So EVYN helps Anna and Amina work together to turn this map into this plan. In comparison, other meal planning apps are automated and focus on singular goals such as weight loss. EVYN applies evidence-based nutrition principles to traditional foods in an affordable and condition-conscious way. Our business model is subscription, so we'll start with user licenses and move up to a freemium. The personalized nutrition market is already reaching 8.5 million people, and it has three main segments. The first being dietitians and nutritionists and their associated hospitals, clinics, and private practices. The second being families and individuals who want to help support everyone in their home to eat well. And further down the line, we envision working with institutions such as schools to provide representative healthcare education for kids. In light of this, we started our validation with over 40 dietitians and nutritionists who told us that personalizable graphics and simplified software are the way of the future in this industry. We also found that of people who already use an app to monitor their health, most find the information too generic and often conflicting, and they need visuals when trying to learn or understand new health concepts. Right now, we're working on prototyping, and by 2025 plan to have contracts and begin to translate EVYN into other languages. So today, we're asking for £4,000, 60% going to prototyping and regulatory compliance, the remaining into community development. As a solo founder and CEO, I'm uniquely aligned to help EVYN succeed. I have a deep knowledge of this arena, not just from my educational background, but from my experience in working with real people who want to feel better. Help Anna and dietitians everywhere get everyone the personalized nutrition that they need.